Welcome to my YouTube channel D&D Patshala. First of all, wishing you all a very happy Sankranti and let this festive season bring with its endless happiness and joy in your faces. So let's get started with our drug of the day, Enoxaparin. So before discussing the drug of the day, Enoxaparin, I want to convey you all an important note, that is the drug information provided in this video is just for educational purpose and for providing knowledge. If anyone use this drug without doctor's advice, by seeing the video, and if you face any kind of problems by this drug, then it is not our channel fault or responsibility for the person who took the drug. So let's get started. So before discussing the drug, I want to discuss the blood clotting factors which are present in our body. There are 1 to 13 factors: fibrinogen, prothrombin, tissue factor TF, that is, it is abbreviated as TF, calcium ions, proacylserine, proconvertin. The sixth factor is not named, and eighth factor is AHF, anti-hemophilic factor. Ninth is PTC, plasma thromboplastin component, PTC. 10th is Stewart factor. 11th is PTA, plasma thromboplastin antecedent. 12th is Hagman factor. 13 is fibrin stabilizing factor, FSF. And the functions of these factors are: fibrinogen will convert into fibrin, means it is like an insoluble type of web-like mesh that which is formed on the clot. It is a type of substance. Prothrombin, it will convert into thrombin, means this will be help in the conversion of fibrinogen to fibrin. Tissue factor will activate extrinsic pathway, and the calcium ions are essential in all the stages of the coagulation process. So that's why they are needed and always present. Proacylserine is also a common pathway, and proconvertin, these will be in both extrinsic outside and intrinsic inside pathways. And the other factor, that is anti-hemophilic factor, and PTC, plasma thromboplastin component, and the other is the plasma thromboplastin antecedent. These are the intrinsic pathways, and their deficiencies can be seen within. The AHF deficiency result in hemophilia A, PTC deficiency in hemophilia B, PTA deficiency in hemophilia C. Next, coming to the Stewart factor, it is a common pathway, Hagman factor or Hagman pathway, intrinsic pathway, and it will be activating the plasmin, means it will initiate the clotting, and the activation will initiate inflammation. And the last factor, FSF, is it will be showing the functions cross-link fibrins, means because of this cross-link fibrins it will be forming a very type of strong and a stable cloth. And when you observe these sources, most of the clotting factor sources are liver and the platelets. So most of the liver will be performing the functions by producing these factors. And coming to the differences between this UFH and versus LMWH, the UFH means unfractionated heparin, that is the normal heparin, and LMWH is the low molecular weight heparin. So unfractionated heparin is, it can be taken by IV or subcutaneous. Low molecular weight heparin is subcutaneous heparin, and this unfractionated heparin, it is rapid type of onset or the clearances, and anticoagulation effect that which can be easily monitored. And this unfractionated heparin advantages are, so these all are the advantages like rapid clearance, anticoagulation effect can be monitored, renal failure conditions are also okay, means this drug can be taken in a necessary conditions, and it can be rapidly reversed with protamine, means it is an antagonist. If the overdose occur because of the heparin, protamine will be helpful to reverse the effects of heparin, means it will be helpful in a antidote form. Low molecular weight heparin advantages are longer duration of action when compared with the heparin, and it is administered in the subcutaneous route. And the low molecular weight heparin's lab monitoring is also not necessary, mostly regarding the anticoagulation effect. So the unfractionated heparin's disadvantages are frequent monitoring is required, and the adverse effect like heparin induced thrombocytopenia. Low molecular weight heparin's disadvantages are, it is mostly contraindicated in renal failure, and it is less reliable reversed with protamine. means the effects are reversed with the protamine drug. It is in a very less range, means the effects can be decreased to a less range. And heparin induced thrombocytopenia's data is very less when compared with heparin, means the risk is equal to or lower when compared with unfractionated heparin. So these are the advantages and the disadvantages of the heparins, unfractionated heparin versus low molecular weight heparin. So let's get started with our drug of the day, enoxaparin. So what you are seeing in this picture is the chemical structure of the enoxaparin. So when coming to the chemistry of the enoxaparin, by seeing this structure, the molecular formula is C26, means the carbons are 26, hydrogen 42, nitrogen 2, oxygen 37, S are 5. So when coming to its IUPAC name, it's 6 hyphen 6 hyphen bracket 6 hyphen bracket 5 hyphen acetamido 4 comma 6 dihydroxy 2 sulfooxymethyl 1 and oxane 3 aryl oxy 2 carboxy 4 hydroxy 5 sulfooxy oxane 3 aryl and oxy 2 hydroxymethyl 5 sulfoamino 4 sulfooxyxan 3 aryl oxy 3 comma 4 dihydroxy hyphen 5 hyphen sulfooxyxane 2 carboxylic acid. So this is the IUPAC name of the enoxaparin. And when compared with the heparin, its molecular weight is low, means 4500 daltons, and when it is and the other kind of molecular weight which is represented not in daltons, it is 1134.9. Let's discuss the brands and their costs. So injection Clexane, 2 ml, that is 0. It will be consisting of this 20 mg of enoxaparin. It is of 395 rupees. 0.8 ml injection will be consisting of 80 mg drug, and its cost range is of 1102 rupees. Qtinox injection is 0.8 ml 80 mg, 480 rupees. Loparin injection 40 mg drug 0.4 ml is 319 rupees, and Lupinox injection 40 mg 0.4 ml 379 rupees. So these are some of the brands of the enoxaparin drug and their related costs. Now coming to the pharmacological information, this drug will be belonging to the class anticoagulant or the low molecular weight heparin, and these are used. This enoxaparin drug is used for the DVT, acute STEMI, prophylaxis of prosthetic arthroplasty of hip, ischemia, non-Q wave MI, prophylaxis of thrombosis in HD patients, prophylaxis and the treatment of VTE, catheter or implant induced thrombus, prophylaxis of prosthetic cardiac valve thrombosis. So this DVT, before saying DVT, we can say VTE. VTE means venous thromboembolism. This venous thromboembolism is a collection of two disorders. One is this DVT and another one is PE. DVT means deep vein thrombosis. The clot formation will be formed within the deep vein in the legs. When compared in the pulmonary embolism means the clot will be traveled towards the lung. So these drugs, that is the enoxaparin, is used in the DVT and also in the combination disorders like VTE. Acute STEMI, as all of you know, STAMI. STEMI is ST elevation myocardial infarction, means the lower chambers will be getting affected, and the prophylaxis of prosthetic arthroplasty of the hip. The arthroplasty means it is a surgery that which is done to restore the particular function of that region. Like if it is also done to the knee arthroplasty means to restore the joint function. Here it is hip. So to restore the hip joint function, the prosthetic arthroplasty means it is a artificial implant that which is inserted in our body. And ischemia means the reduced oxygen in the blood supply. Non-Q wave MI means here the deep progression of the Q wave will not occur in this MI. And also the prophylaxis of the thrombosis in HD. HD means hemodialysis patients. So the hemodialysis patients will be having more number of complications. that we will be discussing in the further videos. So prophylaxis is also done for the thrombosis in this HD patients by using this drug. And catheter or implant induced thrombus means the thrombus, that is the blood clot that which is formed because of catheter or any other implant, and the prosthetic cardiac valve thrombosis. So mostly for the thrombosis conditions, prophylaxis and also for the treatment, prophylactic treatment and after treatment, this enoxaparin is mostly used. Now coming to their available strengths, these enoxaparin is available in two concentrations. One is 100 mg per ml concentration and another one is 150 mg per ml concentration. So in the 100 mg per ml concentration, it is available in three forms in one form. So in 100 mg per ml, there are actually three kinds: pre-filled syringes, graduated pre-filled syringes. So what is the difference between this pre-filled syringe and graduated pre-filled syringe? So in the both, the drug will be already pre-filled, but when the graduated pre-filled syringe means, the graduated means it is in a set mode, means if it is set to 20, it is then it will be up to 20. If it is 60 or if it is 80 or if it is 100, like here in the 60 mg, 100 mg, 80 mg, it will be set up to 60 mg drug with that specific ml or with that specific strength. So here in the pre-filled syringe, it is available in 30 mg per 0.3 ml, 40 mg per 0.4 ml. Graduated pre-filled syringes are available in the doses of 60 mg per 0.6 ml, 80 for 0.8 ml, 100 mg for 1 ml. And multiple dose vials means the 300 mg per 3 ml and 150 mg per ml concentrations means graduated pre-filled syringes. Those are 120 mg per 0.8 ml, 150 mg per 1 ml. So these are the available strengths with the available concentrations. So let's discuss the mechanism of action. I have explained the clotting factors in the previous slide. So if you relate that slide with this mechanism of action slide, it will be binding, this drug will be binding with the antithrombin 3, that is, which is a serine protease inhibitor. So with binding of this antithrombin 3, it will be forming a complex. So by forming a complex, it will be irreversibly inactivating the factor 10A. So by inactivating the factor 10A, the enoxaparin will be released and it will bind with the antithrombin molecules like factor 2A, that is the thrombin. So by binding with the other antithrombin molecules, it will be directly inhibited by this drug, that is enoxaparin. So not only the inhibition of that is the factor 10A by binding with antithrombin 3 and the factor 2A, the enoxaparin will be also causing the antithrombin 3 dependent inhibition by inhibiting the other coagulation factors like 7A, induction of the endogenous tissue factors TFPI, release as well as the reduced release of this VWF, which is one of the clotting factor, that is von Willebrand factor, from the vascular endothelium, that is in the blood circulation. So from the blood, in the blood circulation from the vascular endothelium, the reduced release of this VWF, that is von Willebrand factor reduction, will occur by the induction of these factors. So this is a brief mechanism of action regarding the enoxaparin. Now coming to the pharmacokinetic information. First of all, the pharmacokinetics means what the body does to the drug. In the pharmacokinetics, there are actually four parameters. One is A, D, M, E. These are the four parameters. A for absorption, D for distribution, M for metabolism, E for excretion. So absorption is actually 100% in the normal patients and obese patients if this is given in a subcutaneous route. Regarding the activities, anti-10A factor activity, it is 100% absorption. And when coming regarding the anti-2A, that is the thrombin activity, it is 85% in the normal patients and 75% in the obese patients. So the next is the Tmax. So what is this Tmax means? The drug that which reaches to its maximum range of concentration, or when the drug will be showing its maximum effect, that time is reported as the Tmax. So when this Tmax regarding this enoxaparin drug, when it is given in subcutaneous route, Regarding the activities, anti-10A activity means the Tmax will be 3 to 3.5 hours. Anti-2A 4 to 4.5 hours. And in the hemodialysis patients, 3.5 hours. And in the obesity patients, the anti-10A factor activity will be 4 hours. And anti-2A factor activity, that is the Tmax activity, will be 5 hours. So these are the absorption. Now coming to the distribution. So we have discussed VD. So what is this VD? VD means volume of distribution. So what is the important role regarding this VD means? The VD will be deciding the dosing frequency and the elimination T half-life of a particular drug. So when compared with the other patients, in the normal, VD is about 4.3 liters. And the continuous IV infusion, this VD will also be deciding the drugs if they are tissue bound or if they are in the plasma bound also. So if the VD is high, they are mostly in the tissue, means the plasma circulation will be less. Such type of factors are also mostly seen in the VD. And as I said in the previous point, normal 4.3 liters. And if this drug is given in continuous IV infusion, 9.46 liters. 1 to 18 years of age, 121 ml. In hemodialysis patients, 9.3 liters. And in the pediatrics with the venous thromboembolism, 161 ml per kg. So these are the VDs in different situations. And when coming to the pregnancy women, if they are of 12 to 15 weeks of gestational age, their VD will be 4 liters. 30 to 33 weeks means 3.7 liters. And after the delivery, that is the postpartum period, they will be having this VD 3.1 liter. So when coming to the metabolism, the primary hepatic metabolism will be by the first type of reactions, like that is either may be desulfation or either by the depolymerization. And when coming to the elimination half-life, so these are about when it is given through IV 2 to 4 hours, when through subcutaneous route 4.5 to 7 hours, and when it is given in continuous IV infusion, it is of 7.4 to 15.1 hours. And hemodialysis means 8 hours. Excretion ranges, it is about renal. When coming to the renal, it is in 10% unchanged, that is to 50 to the 8 to 40% with the 10% unchanged. Next, what I have said, this 15 is the TBC, that is the total body clearance, is about 15 to 26 ml per minute. And the TBC, that is the anti-10A activity, when it is given in continuous IV infusion, it is of 0.59 liter per hour. In hemodialysis, it will be in unchanged, but in the 13.4 ml per minute excretion rate will be there. And in the pediatrics, those who are having this VTE, they will be having an excretion rate of 15.2 ml per hour per kg. General pediatrics 1 to 18 years, 9.26 or 26 ml per hour. And in the pregnancy conditions, 14.26 ml is being seen per minute in 12 to 15 years of gestation. And in 30 to 33 weeks, 11.7 ml per minute. 10 ml per minute is seen after the postpartum. And in obesity, 0.01 to 0.019 liter per kg per hour it is seen. So these are the ADMA parameters. Now coming to the adverse drug effects and the contraindications are, so most of the common effects that which can be seen through this drug are fever, diarrhea, nausea, pain. The pain and the swelling can be seen at that particular injection site. Anemia, that is the decrease of the blood count. Thrombocytopenia, increased in the, so biochemical parameter side effect is increased LFTs, means we can see a increased levels of the liver function tests. And when coming to the serious adverse effects, hemorrhage, paraplegia, pneumonia, skin necrosis, means the particular skin cells will be dead, heart failure and atrial fibrillation, such type of adverse effects can be seen. And in which persons this drug is contraindicated? So these persons are of active bleeding disorder, means who are having this active bleeding disorder, and the persons who are having any history of immune mediated, means autoimmune type of thrombocytopenia. And it is also avoided or contraindicated with a defibrotide drug, means if it is taken with this defibrotide drug, it is a it will be showing one of the serious type of fatal reactions by increasing the risk of the bleeding, and obviously hypersensitivity reactions with this drug. So these are some of the contraindications that which are related with this drug. And when coming to the interactions, so there are so many interactions of this enoxaparin drug, and some of the important interactions of this enoxaparin drug are NSAIDs, rivaroxaban, citalopram, sertraline. Such type of drugs, if this enoxaparin is given with combination with these drugs or with other kind of drugs, like other type of, in the NSAIDs there are different types, so these may cause or result in the increased risk of bleeding. And when coming to the food type of interactions, asafoetida means hing, which we will be using in our cooking, and clove oil, and also celery, that which are used in our salads, and in our clove oil is also mostly used in the dressing and also in some kind of medicines. This can also result in the increased risk of bleeding. And you must have seen this PC, it is given the B category. So PC means pregnancy category. So these are of, I'll be discussing this pregnancy category and their information in the further videos. But for now, this pregnancy category of this enoxaparin drug is B. So patient education. So what we should tell the patient before giving this drug. So we have to educate the patient that this drug may cause edema, and I have discussed in the previous slide the side effects like diarrhea, nausea, hematoma, confusion, pain, dyspnea, fever. Such type of these are the side effects that which will be mostly causing. And we have to also instruct the patient to report if there are any kind of signs or symptoms of bleeding, pulmonary edema, or any kind of skin necrosis or atrial fibrillation. And we also have to advise the patients who are having or receiving spinal anesthesia or epidural anesthesia with any kind of neurological impairment symptoms or signs, as this drug will be increasing the risk of the development of the spinal hematoma and even though epidural hematoma. And if the self-administration means, if the patient is self-administering this drug, the patient is to be advised to rotate the injection sites, means he or she shouldn't take that injection at the same site, and they should lie down during this injection, and they should also avoid the concurrent anticoagulants like aspirin, NSAIDs without the healthcare professional's approval. And we should also advise the patient to call the healthcare professional if the dose is missed or if the drug is not given in a regular schedule. So this drug should be taken in a regular schedule, so the dose shouldn't be missed. So we have to advise the patient. So the another important section of this drug is do not confuse section. So as there are many kind of medication errors, so some of the type of LASA errors, means look alike or sound alike type of errors. So this is one of the error that which we can see in this do not confuse section. So many patients or so many members will be mistaking this drug with Levemir. So most important brand that which is used of this enoxaparin is Lofinox. So the Lofinox is mistaken with Levemir. But this Levemir is a long acting insulin which will be working up to 24 hours. That is the insulin detamir injection. So this will be used for both type 1 and type 2 diabetes. So this is the drug information that which I am providing through this video. I hope you all have understood the drug information in an effective and in a very informative manner. And that's it for this video, and thank you so much for your patience.